And what about the nanopore? The nanopore is about sequencing anything, anywhere, by anybody. It's easy, yes? Now sequencing is easy because of the nanopore, but I will show you the pain that can still exist somewhere there. And today, I start to be interested in the co-infections. The co-infections is where when the more than one, two or more viruses infect the same person. They do not need to infect the same cells, but they need to infect the same persons. And for the respiratory disease, it's mainly by of course, SARS-CoV-2, influenza A, B, RSV, and then the other respiratory viruses. And biggest problem is that the co-infections can increase the severity of the disease, and it's can be very it can be problematic to treat it also because of the diagnostic, and the group that is especially involved in this, it's the small children, like the 5 years or lower, and the elderly, and the people during or after chemotherapy. And for now, the diagnostic is based on the multiplex PCR, which is often the proprietary system, closed systems, or the in-house developed multiplex PCRs. And this is quite a common problem because by the sorry. And the approaches to diagnose the co-infections is based mostly on the multiplex PCR and NGS, of course, and lateral flow devices. But this is the biggest problem for those techniques based on the PCR and the lateral flow devices, or is that you just detect the signal. You do not detect the raw sequence. You detect the signal that is multiplied through the whatever technology you are using. So because of that, you have a lot of problems with detecting the false positive signals or the amplification of the unspecific products. And to fight with it, you can use the sequencing, especially nanopore sequencing, of course. Because the nanopore is cheap, it's small, and can be used even near the point of care, and it's specially designed to work with the complex samples where the co-infections, where the one virus is much bigger. There is a more single virus and the low availability of the second one. And because you analyze the raw data, your results are almost free from the false positives based on the, for example, positive control, because the sequence of the positive control will be quite different of the sequence of your sample. And of course, there exists the cross-contamination. That's normal, but because you multiplex literally it's unlimitedly targets that you can detect, so you don't need to put multiple reaction per single sample. So this is also something good, and I will show you what we are doing now. What we are working now, first, of course, after the sampling, we do the total nucleic acid isolation, and then we use the targeted amplification. So we use the primers to amplify our targets, and then we go with the library preparation. We use the rapid barcoding, so it's really fast, and then the real-time interpretation and evaluation what we really have in the sample. We target almost, I think, all the main families of the viruses that are infecting human upper respiratory tract. And what we done in the beginning, we just analyzed really thousands of the sequences, And then we use the phylogenetic analysis to group those sequences, because for the rhinoviruses, for example, there are so many of them, they are so different, so it wasn't easy just to, to design one pair of primers. So there were multiple pair of primers only for rhinoviruses. And we didn't want to use the published data, so we make everything from the scratch, from the beginning. And this was quite easy, I must say. This was easy. The true pain just start next to that, so the optimization. So we need to optimize everything, the primer sequence, of course, because they are degenerate, that's a problem, but you need to optimize the temperature, how many steps, how long the steps, what is the concentration of each primer, and that was a lot of work just to optimize. And but I think we achieved that, or almost achieved that. So we are able now to detect as low as 10 copies of the targeted virus in the mix of other viruses. And that's something nice, we think. But still, this is work ongoing, so maybe we'll go lower, who knows. I hope so. And yeah, so we also done some research validation when we use the clinical samples, but I must say those clinical samples, when they were fresh, they were analyzed on the IVD, by IVD methods, and then there was freeze, defroze, freeze, and you know how it is. And we get the samples that were not perfect, but we achieve like 92% of the same results as IVD method. So I think because of the samples were not good, some of them were terrible, I think it's still nice. But we also done the validation on the cultivated virus, like the 50 samples, so with different mix and match. So we have 100% hit. So we are quite happy with that. And my conclusions for the presentations is like we were able to create the completely new method based of nanopore technology that was able us to detect, differentiate multiple different viruses in the single sample. We were able to detect as low as 10 copies of the virus per single sample, but still work is ongoing. And also this was only happened because of the nanopore sequencing, because we were not looking for the signal. We were looking for the sequence, yes, and this and because of that, you not only detect, but also you can see how the epidemic is spreading, who is infecting whos. That is impossible doing the other technologies. And in the end, I would like to thank the people who was involved in that, from the clinical center, from the military institute, from the University of Gdańsk, and from the company of Vaxican. And especially for Maciej, because this is mostly his PhD thesis. So yeah, thank you very much.